Hi, good morning. I'm Dr. Cabeca, and I'm here to talk to you about a topic that is very important to me, and that is the vagina. We want to address vaginal health today. Let me introduce myself. I am a gynecologist and obstetrician. I was trained at Emory University, then I furthered my training in functional medicine and age management. My goal is to keep us as healthy as we can be, functioning our best throughout our years, and that goes for a head-to-toe approach. Today, stopping in the middle and addressing the vagina. Why? Why do I take this so seriously? Well, certainly because I'm a gynecologist, but also when I first left Emory University and started practicing in rural Georgia. I live on St. Simon's Island, and I had a clinic in McIntosh County, Darien, Georgia. 3 of my patients in the first 6 months had serious vaginal disease, and that included 2 with vaginal cancer and 1 with a precancerous condition that was so severe. Often, I've heard statements from patients telling me we were told we never need to have another pap smear after we've had a hysterectomy or after I reached menopause because we wouldn't have any other issues. This is a very grave misconception and misinterpretation. The pap smear certainly is a cancer screening test for the cervix, but it also assesses vaginal cancers and continues to be important. The frequency may be decreased to every 3 years, and there is some discussion, controversy among the American College of OBGYN and recommendations regarding pap smears after hysterectomy. Regardless, the vagina still needs to be examined. The vagina is a very important aspect to all our health. Consider this. All life has begun at some point or another through or within the vagina, correct? So we continue, despite being past reproductive years, consider the vagina very, very important for overall health. Vaginal dryness, vaginal pain, atrophy, prolapse, or loss of pelvic support, vaginal support, allowing the bladder to sink, the rectum to prolapse into the vagina. These are considered issues of poor vaginal health and poor muscle strength in the vagina, as well as can be associated with fascial breaks along the vagina. More on that a little bit later. What I really want to address today is this vaginal health crisis. We need to maintain our healthy vaginas throughout our life because this is also a significant indication of how our internal health is. The vagina is a representation of our internal health. And ladies and gentlemen, sex continues throughout our lifespan. There's no age limit on sex, and our age does not prohibit, inhibit, or determine anything regarding our vitality. In fact, we wear our age as a badge of honor, and we want our health to be as optimal and our function to be as optimal. You can look around you and see those individuals who are well past reproductive years living optimally and vitally, and I want that for all of you. Back to the vagina. Sorry, get off on a tangent every once in a while because that's my passion. I want you to be the sexiest younger you that you can be. So, starting with the sexy younger vagina. Anyway, so the vagina is very, very important. Several factors can make a difference in vaginal health, addressing specifically the lining of the vagina, the mucosal layer, the muscular layer, and the intimal layer, the layer in between. So the health of this tissue can be affected by our intestinal health. Do we have enough good bacteria within our body? Is the acid pH balance stable? The vagina should be acidic, and that will keep bacteria and infections reduced. I want to give you 3 key things you can do today to help with vaginal health, address vaginal dryness, pain during intercourse, and recurrent vaginal discharges. So my key 3 things to vaginal health are healthy vaginal probiotics or internal probiotics and a healthy digestive system. I often use a probiotic, and you can get many strains of different probiotics, but Lactobacillus and Bifidobacter are the ones most commonly used for the vagina. You can take them orally for sure, and these are preferred usually on an empty stomach. But you can also make a vaginal douche with suppository using filtered water. A little bit, you can insert or dissolve a vaginal, a probiotic capsule that has at least 50 billion multi-strains of good bacteria, and mix it into water and douche with it, or insert it with a little bit of yogurt if you don't have a dairy intolerance into the vagina. And this can be very helpful. But having a healthy GI tract, you can take the probiotic internally, again, mix it up with some water and gently douche with it. It's the only time I'll recommend douching. Otherwise, I highly am against douching because it does disturb the vaginal pH. But using a healthy probiotic can be very beneficial. And you typically get them orally at a quality health food store. I have some available on my website as well. And high quality strains make a difference. So, probiotic. The second thing is vaginal moisture during intercourse, or as a lubricant, or to help with vaginal dryness, which can be very uncomfortable. Little bit of I know you're wondering what this is in a clear container, but this is one of my favorite oils. This is coconut oil. This is an extra virgin organic coconut oil. And a little bit of coconut oil goes a long way. It's great for vaginal moisture. It's great as a lubricant. It's very healing and nurturing to the skin, especially the tender vaginal area, and it will not irritate or burn. So a little bit of coconut oil can go a long way. You can cook with it as well. Very good to cook with, one of my favorite cooking oils. But back to the vagina. The third thing I want to tell you about is vaginal DHEA tablets. Let me give you some research on DHEA, which is really important. There was an excellent study published in the Journal of the published by the Journal of the North American Menopause Society called Menopause, and it addressed the effects of vaginal DHEA, or dehydroepiandrosterone, on libido and sexual function in postmenopausal women. And it showed that 10 milligrams of vaginal DHEA over a period of 12 weeks had a 23% improvement of desire, had an improvement by 75% of arousal and lubrication, and an improvement of 57% in dryness during intercourse. All this compared to a placebo. So the results were all universally significant and improved. So that is really key. Another study looked at the effects of vaginal dryness and DHEA use at different 5 milligrams and 10 milligrams, as well as the 2.5 milligram dosage. And the 5 and 10 milligram dosages were significantly improved in vaginal dryness and atrophy in all 3 layers of the vaginal tissue, including the musculature, without any systemic or increase in blood levels of estrogen. And that is key. So estrogen works only on the lining, the mucosal layer, but DHEA is going deeper. So my patients are finding this to be so amazing. And how you use the vaginal DHEA is quite simple, actually. So these are tablets, and I worked with a pharmacy to create these tablets because suppositories melt. I'm in Southeast Georgia. You know, we're going to hit 90, 100 degrees today, and we've got tons of humidity. So suppositories will melt, and that's always an issue in sending them to patients and patients getting them and leaving them in their car for a few minutes. So created these tiny, tiny vaginal tablets, and they're 10 milligrams. So I typically will start a patient at 1 DHEA 10 milligram vaginal tablet every day for 2 to 4 weeks till they restore their vaginal health. And then many women can go down to 3 to 5 times a week, some less, some need to continue for 1 time a daily until we get good restoration in the vaginal tract. There's been reported, one of my patients says, Dr. Cabeca, my vagina's 20 again. And so I'd love for your vagina to grow young along with you. Very, very important. So the way you use this, you'll insert you can insert the vaginal tablet. Very easy. You can insert it with your finger and just insert it even halfway into the vagina, or push it all the way up, whatever. It will stay in there. It does not create a icky, yucky, excessive discharge like many suppositories. So my patients really like this. And you can also use this vaginal applicator, one similar, and you insert this into your vagina just like you would a tampon, and out comes the tablet. Remove the applicator, rinse it off. It's ready, hot water. It's ready for your next use. Perfect. So those are 3 key things you can do right now to start improving your vagina: coconut oil, probiotics, and vaginal DHEA. As always, I'm wishing you a Vita Pura. This is Dr. Anna Cabeca. There's more information on my website at cabecahealth.com/page/news, and you can see the articles I'm referring to you from the scientific journals. I look forward to speaking with you again.